Imagine a world, not so different from our own, where an unseen enemy lurks within the very fabric of life. This isn't a monster from mythology, but a rebellion that begins in a single microscopic cell. This is the story of cancer, a tale as old as complex life itself, woven into our history, our biology, and our deepest fears. Our journey starts not in a modern hospital, but thousands of years ago, in ancient Egypt. Picture an embalmer, working by torchlight, discovering a hard, unusual mass in a mummy. The Ebers Papyrus, one of the oldest medical documents known, written around 1500 BC, describes these tumors. The Egyptians had no name for it like we do, but they recognized its destructive power. For a bulging tumor on the breast, their advice was stark: there is no treatment. This wasn't a failure of spirit, but a reflection of the profound mystery they faced. They could see the disease's effect, but its origin was a complete enigma. The story gets its name centuries later, with Hippocrates in ancient Greece. The father of medicine, he observed tumors with tendrils spreading into surrounding tissue. They reminded him of a crab digging its claws into the sand. He called it karkinos, the Greek word for crab. Later, the Roman physician Celsus translated this into the Latin cancer. The name stuck, a perfect, chilling metaphor for a disease that latches on and refuses to let go. For centuries, this was the extent of our knowledge. The dominant theory, from the Greek physician Galen, was that cancer was caused by an excess of black bile, one of the four humors thought to govern the body. This idea, that cancer was a systemic imbalance, held sway for over 1,300 years. Think about that for a moment. For more than a millennium, the best medical minds believed cancer was an internal darkness, a melancholy fluid that had gone rogue. Treatments were based on this misunderstanding. Diets, purges, and bloodletting all aimed at rebalancing the body's humors. It was a shot in the dark against an enemy no one truly understood. The first real crack in this ancient theory came with the Renaissance and the advent of human dissection. Andreas Vesalius, a pioneer of anatomy, began to question Galen's teachings. By studying the human body directly, he and others started to see that cancer wasn't a free-floating evil humor. It was a localized disease, a physical growth that began in a specific place. This was a monumental shift in perspective. If cancer was local, maybe, just maybe, it could be removed. This led to the heroic age of surgery in the 18th and 19th centuries. Surgeons, armed with little more than sharp knives and incredible courage, attempted to cut the disease out. Imagine the scene: no anesthesia, no understanding of germs. These procedures were brutal, agonizing, and often fatal. Yet, they were born of a desperate hope. Surgeons like William Halsted pioneered the radical mastectomy, removing not just the tumor, but the breast, lymph nodes, and chest muscles, believing that aggressive removal was the only chance. It was a testament to the idea that this crab-like invader had to be completely excised, no matter the cost. But surgery alone wasn't enough. Often, the cancer came back. Why? The next piece of the puzzle came from an invention that changed everything: the microscope. In the 19th century, a German scientist named Rudolf Virchow peered through his lens and declared, "Omnis cellula cellula, all cells arise from cells." He was the first to realize that cancer is a disease of our own cells. It wasn't an alien invader, but a civil war. Our own cells, for some reason, had gone rogue, breaking the fundamental rules of division and growth. This discovery was earth-shattering. The enemy wasn't black bile. It was us, our own biology twisted. This cellular theory opened the door to modern cancer research. If cancer was made of cells, what was causing them to misbehave? The hunt for the cause was on. Researchers began to identify external triggers, what we now call carcinogens. In the 1770s, a London surgeon noticed that chimney sweeps had a high rate of scrotal cancer, linking it to soot exposure. In the 20th century, scientists confirmed the link between smoking and lung cancer, and radiation and various malignancies. The story takes another turn with the Curias. Marie and Pierre Curie's discovery of radium at the turn of the 20th century was both a blessing and a curse. They noticed that this glowing element could kill living tissue. This led to a radical new idea. What if you could use this power to selectively kill cancer cells? This was the birth of radiation therapy. Early machines were crude, and the line between a therapeutic dose and a lethal one was terrifyingly thin. But for the first time, doctors had a non-surgical weapon to aim at tumors. Then came the Second World War. A ship carrying mustard gas was bombed in an Italian harbor, and sailors exposed to the chemical experienced a sharp drop in their white blood cell counts. This tragic event sparked an idea in the minds of two pharmacologists, Goodman and Gilman. If mustard gas could destroy normal white blood cells, could a similar chemical be used to destroy cancerous white blood cells like those in leukemia? In 1943, they secretly treated a patient with a derivative of mustard gas. The patient's tumors shrank dramatically. The remission was temporary, but it was a breakthrough. It proved that a chemical, a drug, could fight cancer systemically. This was the dawn of chemotherapy. The war on cancer was officially declared in the 1970s, and for decades, the primary strategy was a three-pronged attack: cut it out with surgery, burn it with radiation, and poison it with chemotherapy. This approach saved millions of lives. But it was a brutal fight, often damaging the body as much as the disease. The real revolution, the one we are living through now, came from understanding the why. Why do our cells go rogue in the first place? The answer lies in our DNA. In the late 20th century, scientists began to unravel the genetic code of life. They discovered specific genes called proto-oncogenes that control cell growth. They also found tumor suppressor genes, which act as the brakes. Cancer, they learned, is what happens when these genes mutate. A series of unlucky genetic accidents can turn a proto-oncogene into an oncogene, stepping on the gas pedal of cell division, while mutations in tumor suppressor genes cut the brakes. The cell loses control, dividing endlessly, ignoring signals to stop, and eventually invading other tissues. This genetic understanding has transformed everything. We're moving away from the one-size-fits-all approach of poisoning all fast-dividing cells. Now, we can analyze the specific genetic mutations of a person as tumor and use targeted therapized drugs designed to attack only the cells with that specific mutation. We are also harnessing the power of our own bodies with immunotherapy, which essentially teaches our immune system to recognize and attack cancer cells as the invaders they are. It's like finally giving our internal police force the right mugshot. The story of cancer is a story of human ingenuity, resilience, and relentless hope in the face of a terrifyingly intimate enemy. From ancient Egyptians who saw its shadow, to Greek physicians who gave it a name, to modern scientists who are decoding its deepest secrets. It's a battle fought not just in labs and hospitals, but in the hearts of every patient and family touched by it. The war is not over, but for the first time in our long history, we are not just fighting the crab. We are learning its language, understanding its weaknesses, and turning its own biology against it. The path forward is brighter than ever before. Thank you so much for joining me on this journey through one of history's most complex stories. If you found this fascinating, please give this video a like and subscribe to the channel for more deep dives into the history of things. See you next time.